All right. Assalamu alaikum, everyone. And thank you for joining us for our invited lecture series. So to introduce myself, my name is Dr. Sumaya Gahan. I am a doctor working in the West Midlands. In terms of my role within the BSMA, I'm the mentorship and widening participation lead. We've also got here with us Dr. Zakaria Ali. He's going to introduce himself.
Assalamu alaikum, everyone. So I'm a consultant pediatrician at University College London Hospital, and I'm one of the vice presidents of the BSMA.
Okay, and our phenomenal speaker for today, which I personally am thoroughly excited for, is Dr. Qaali Hussein, who's a trauma surgeon based in the United States. So I'm just going to hand it over to Dr. Qaali Hussein.
Assalamu alaikum wa rahmatullahi wa barakatuh, everybody. Thank you so much to the BSMA and Sumaya and Zakaria for inviting me. Really excited to be here. I wish it was in person. I'd love to travel there. But I'm really excited to be here with you guys today to share with you guys my journey of becoming a trauma surgeon here in the States while trying to maintain, my deen and my dhaqan and, the dhaqan of Somali women having a lot of kids and all of that. So thank you for having me.
Okay. So we are really, really, really lucky to have Dr. Qaali Hussein. So I'm sure all of you will have lots and lots of questions to ask her. So please ask all of your questions in the chat, and then I will ask those questions on your behalf as well. Our main thing is at the moment is we want to learn from Dr. Qaali Hussein, her journey, her achievements, and how she manages to have it all. So Dr. Qaali Hussein, we'll leave it to you.
All right. So, so one of the things that I always talk about when I talk to a Somali audience, especially a young generation who is looking into pursuing, these high-powered, very competitive, very busy, and time-consuming fields is, the entrance into the journey, I always feel like is one of the biggest impediments to overcome. And so where does that come from? So there are multiple sources of complications and difficulties in pursuing these fields. One is in these systems, in these Western systems that where most of us are training in the diaspora, is there is a barrier to entry. Right, there is very little mentorship, very little sponsorship, meaning people will actually take you along on the journey and teach you the ropes and show you what, how to get through the system. Two, there's, persistent bias, right? When we come into the States or, into Western society, one of the things that we're told is we should assimilate, right? We should adopt the culture, the dominant culture that we're in, therefore, disavowing our own culture, disavowing, how we practice our deen. And those are one of the things that that message actually comes from not only in these fields whether it's your schooling or your workplace, it also comes from our own communities, right? So from within our own communities, what are we told by well-meaning relatives and well-meaning, family friends, is that, you should not go into this field because you will be told, to take off your hijab, you can't have a family. And I say they're well-meaning because they are telling us what we're going to face, right? For the longest time when I was going through it, I saw it as, they don't believe in me. They have no faith that I am strong enough to overcome this. And so for me, it was, I saw it as discouragement. But in looking back over many, many years, and what I've seen firsthand in trying to work, in trying to maneuver through these systems, is that they were right? Our families, our community, they're absolutely right to say, to try and keep us from pursuing these fields. Some people are not well-meaning and are just discouraging as is, but majority of them, especially family members who care about you and are telling you, maybe you shouldn't, go into this field. Maybe it's not right for you. And it's because their fear that you won't be accepted as who you are, right? So the message that we get from within our own community and, in our workplaces, I feel like is the exact same message, right? That you don't belong as you are. And that basically is based on the idea that these systems cannot change, right? That social norms, what we've accepted, what we've accepted as the norm, to say, you know what, as a woman, your first priority, at all times should be marriage and childbearing, right? Career is secondary. And even if you value the both of them, there's not much we can do to accommodate you, right? That's what we're saying. When we give these messages to young people, what we're saying is that this is how things are and it's not going to change. But in reality, things can change. And it relies on us, right? It relies on the people who want that change, who need that change in order for them to get through the system to initiate that. That's one thing I've learned along the way, is that you have to be the leader. You have to be the person to initiate change. And I'll give you just a couple of examples. So when I went to schooling, I did all my training in Texas. I don't know if you guys know much about Texas, but it's the land of the cowboys, lots of Adam people. And, Houston is where I grew up, and it's very, very diverse. But I went to one of the oldest medical schools in the country, in all of the country, like the entire United States, one of the oldest schools. And as a medical student, as a third-year medical student, I was the first person to ever wear a hijab in the operating room. And as I presented, I'm doing my orientation with a surgery resident along with my fellow students, and a nurse just comes down a long hallway, comes straight at me and says, "You can't be in here with that thing on your head," referring to my hijab, right? And so at this point, I'm paying money to be there, so I'm not going anywhere, right? I'm paying money to be here, so you can't kick me out of something I paid for. And so what happens is the resident, who is supposed to be, the senior person that I report to, walks off with the rest of the students, and I basically stand there to fight for my position, to get my training, to get to do my surgery clerkship. So, I did what I had to do. I said, you know what, put a bunny suit on me, put a hat on me, put a hazmat suit. I don't care what you have to do. I'm getting to the operating room. And so they didn't know what to do. So I figured out, I just tuck my hijab in, make sure there's no loose pieces that can contaminate the field. And I put on a cap, right? And after that, they just incorporated it into their policy, but nobody ever thought to say, hey, why, there may be Muslim women who are going to be pursuing surgery. How can we accommodate them? Not a single person thought of that over however many years that school was open, right? And over the years, I've worked at multiple hospitals around the country. It's the same thing. Every time I come to the operating room, it's the same issue, right? Like, you as a hijabi, how do you get into the operating room? Right. So one of the things that I ended up doing is I worked with a large organization that standardizes operating room attire. And I had them incorporated into their operating room attire, that women who wear a hijab or any other religious headwear, Sikhs, there are many other faiths that practice the hijab, or that practice head coverings. It's incorporated into the national guidelines for the operating room. Right. So that change didn't happen because the powers that be decided, hey, let's be an inclusive place and incorporate everybody and welcome everybody. No, it takes someone who needs the change to make it happen. The same thing with maternity leave policy. My program didn't have a maternity leave policy. The only option I was given was to quit. They said, take the year off, have your kid, decide whether you even want to do medicine or do research or do something that's less strenuous, like internal medicine or family medicine, right? The fact that I could be, a mother, find ways to accommodate my time off and come back and continue my training was not a thought that occurred, to my boss. So it was my willingness to keep going and keep pushing, find the resources that I needed, mobilize my community, my Somali community, my family, who said, you're not going to have kids. Throughout the entire process, it was, you're not going to get married. Got married. You're not going to have kids. I had kids. I went back to work. What's the point of having kids if you're going to keep going back to work, right? But nonetheless, regardless, when I called on them, they came. When I needed their support, and when I needed them to help take care of the babies, there was a time where I was in the hospital 4 days straight because it was just busy. I had people that I relied on. I had a network and family that I relied on to take care of my kids, right? And that's one of the reasons why I always stress, yes, some in the community, sometimes even within our families, might be the ones to discourage you, but majority are well-meaning. Majority are well-meaning because they know what systems we're going into and that it's going to be tough, right? One of the things that I love to teach is reality check, right? I think we get a different sense of, we want people to encourage us and say, I want to pursue this field. And everybody's like, oh, you can do it. You can, it's going to be easy. You're going to rock it, this and that. That may be true, but me personally, one of the things that I try and incorporate into my mentoring is to be realistic, because when you know what's coming, you can prepare better, right? I call it a reality check because you know what? Between you and somebody else who doesn't look like you, somebody who's in the majority, your path is going to be harder. As soon as you have a small setback, you're going to be shown the door. And so it's up to you to figure out, okay, this is going to happen to me. Is that a reason for me to give up? Or are there things that I can do to continue moving forward? And that's one of the reasons why, everybody's like, why are you always talking about, all the negative things? Because that's what you learn from, right? As surgeons, one of the things that we do is we're not always talking about our successful patients and our patients did well. We celebrate that for about 2 seconds. But we focus and put all of our energy into the complications, the patients that didn't do well, because those are the patients that we can learn from. Those are the patients that say, what went wrong here? What did not go right? And how are we going to fix that next time? That's the same way you should approach failures, right? The setbacks. You wanted to get into a program, you worked really hard, you didn't get in. What happened? Right? What can you do better next time? Just because you failed one time, does that mean you give up? No, we don't give up. You keep going and you keep learning. So I'll take some questions now.
Absolutely fantastic. Thank you so much. We already have one question, which is, so how did you find the transition back into training when you did come back from maternity leave? If you ended up having any maternity leave is the real question. And then how did you make sure you just didn't lose your clinical practice, your clinical touch?
So the first time I was pregnant, I was an intern. I was 3 months into my internship. And I sat down with my program director, and this was before I had an ultrasound or confirmed that I knew I was pregnant. And I just I was like, change my schedule. This is when I'm supposed to deliver. And I'm going to come back, soon thereafter. I don't want to lose any time. Mm-hmm. And one of the things that he said to me actually set how I managed my time off. I wouldn't recommend it to anybody right now because it was brutal. He told me that, first he's like, it's impossible. You're an intern, you're pregnant, you're done. And he started actually looking for somebody to take my spot. And I was like, I'm not going anywhere. I'm gonna finish. I just need to know what to do. And he's like, it's never been done. And he said, the last resident and the most junior resident to get pregnant in our program at the time was a 3rd-year resident, and she had yet to come back from maternity leave, and that was 6 years prior. And there was no maternity leave policy. So at that time, it was me and two chief residents who were pregnant like later on in the year, and they were going to have their babies after they were done. So it didn't matter for them. But me, like, I needed a policy that said this is the time that I could take off. So we borrowed it from our OB-GYN colleagues, because, you know, they're all women and they all have babies. But it ended up being just our vacation and sick time. And so my first one, I think, was the longest time I took off. I took 4 weeks off after the baby and came back. Because my thought was, you know, people didn't come back because, you know, as a mother, you get attached to your baby. You don't want to go back to work. And it's, for me, I think I put a lot of myself because, one, I wanted to finish, and two, I didn't want to prove him right. Like, I think that drove me a lot. And in the end, you know, I think people who are negative can give you sometimes like the fire that you need to keep you going. And so I think that's what he's done for me, is he pushed me to push myself even more. But yeah, I came back 4 weeks after my first one. And then I think my second and third one, I came back 2 weeks after. You know, and my plan was just, you know, when I had to go on bed rest for my first one, and I read, like, I got my books on a PDF on my phone, and I read and I did questions. So when I came back, actually clinically, I was a little behind, but, you know, from a medical knowledge standpoint, I read the book. I read like an entire book. And so when I came back and we were doing questions and, you know, practice tests, I did it. And so they kept asking, like, how are you doing this? I used my time wisely. The time that I had off, you know, my first one, I didn't have a kid. It was just me and a TV. So I took the time to study, make sure that when I came back, I didn't give him a reason, because they had all the reason in the world, right? He already told me that he was going to kick me out of the program just because I chose to be, you know, a mother. So if I went back, and my thought process was, if I went back and I gave him a reason to say, you know, like, for me, it was, if I went back and I failed my tests and I didn't perform well. And, you know, we do this thing, I don't know if you guys do it over there, called pimping, where, you know, you present a case or a complication in front of everybody, you know, your fellow residents, your attendings. And so in this public forum, you're asked questions, very difficult questions, hard, like board style questions. And if you get it wrong, you're basically showing, they're showcasing your ineptitude in front of everybody. Right? So that fear kind of, you know, forced me to say, when I go back, I'm going to stand in front of everybody and not look very bright. And they're going to be like, see, Qaali, that's why you don't have babies in residency. So that fear drove me to study and read. And when I went back, you know, they asked me a bunch, like, I got one of the hardest questions I've ever gotten. And I looked at every book and I'm like, this does not exist. This does not, like, a chairman asked me one time to calculate the clearance of potassium or something like that. And I'm like, I've never even seen a nephrologist calculate that. I'm like, we talk about, you know, creatinine clearance and all this stuff. I'm like, potassium? Well, it was like a potassium deficit in someone who's been getting Lasix drip or something like that. I was like, I don't know, right? That was the point. I was getting to a point where I was getting asked things that were beyond, you know, my level, any surgeon's level of expertise. It wasn't even within our field, right? This is like a chemistry, you know, nephrology expert. And so I knew that was going to be coming way before it came, because I've seen my senior residents go through the same thing. I've seen women who've had, you know, who were pregnant and at finishing get, you know, be basically discriminated against because they almost passed out in the operating room. Gosh. Right? Physiological, you know, like, you are not allowed to be human. So that's why I talk about the reality of what it's like to be in these places, because not only are you discriminated against, your humanity is regarded as nothing, right? You know, I work, I don't know, 4 days straight. And the fourth day, I literally had to walk out of the hospital, and my attending kept following me to say, hey, we have more patients to see. And I said, I've seen the patient this morning. You can go see them yourself. I'm done. 4 days straight in the hospital.
Wow.
This is the reality of it.
It's a definitely, I must say, a stark difference to what we deal with in the UK. But my gosh, I think in terms of also from the audience, I think there's a lot of shock, I would say, from what they're hearing that you went through. One of the questions is as well, is that, did you ever have a sense of, did you feel guilty about the amount of training? What training actually was demanding from you and inevitably from your family? And how did you kind of cope with that?
Have I felt guilty about the amount of training? Absolutely. And the way I dealt with it is I try to overcompensate.
I see. So
being away the number of hours that I was away, you know, it kind of eats away at you. Maternal guilt is bad. You know, when I didn't have kids, I was away from my family. I missed a lot of weddings and graduations, and sometimes like I would have to have my aunt call my mom to get her off my back. You know, you use the family politics and dynamics, yeah. And you know, that was okay. But you know, when you have kids and your kids are crying because you're at work, it's gut-wrenching. And so one of the things I did was, when I wasn't working, instead of resting, I would do all these things. Like I would cook, I would clean, I would take them out to the park, I would take them out to ice cream, just, you know, basically making up for the fact that I was gone. And it was my fourth year. No, it was my chief year. I had my younger three and I had twins. And it was my first weekend off in, I don't know how long. I was working nonstop for months. And so my first weekend off, I said, okay, we're going to get the kids in the car. We're going to go get ice cream. We're going to go to the park. And I hadn't rested for months. And we get in the car and I'm physically exhausted, emotionally exhausted. And my husband is in the car and I sit down and I just start crying nonstop. Like, you know, that deep cry, you're like,
the one that really faces the soul.
I like just from pure exhaustion. And it scared the heck out of my kids and it scared my husband. And they were like, what's wrong with you? And I was like, I'm tired. I need to take a nap. And they're so sweet. So they're like, okay, you don't have to do anything. We don't want you to cook. We don't want you to do anything. Go sleep. So, you know, we went, got the ice cream. My husband took the kids that night to, you know, take them to a movie or whatnot. And I slept for, I don't know, like 12 hours. Like just, you know, and that's one of the things that was like a very, very low point, because I realized that I was in two different worlds, where in this world at work, I was constantly pushing myself, operating, doing cases. You know, I ended up doing like a lot more cases than, you know, some of the a majority of the residents, because, you know, once I got control of the schedule, I was like, okay, I'm gonna operate. Right there, I lost some time. I'm going to make up for it, and I'm going to operate and make sure that by the time I finish my training, I'm skilled. And so I was fighting this battle at work, and then at home, I was fighting this other battle of, yes, I can be a surgeon, but I can also be a good mom. I could be a good wife. I could be a good daughter. I could be a good this, right? So I was in these two different worlds, you know, going back and forth between the two of them, where I'm always trying to prove something, right? And I never felt confident that it was enough. And it wasn't until I had that mental breakdown of just from pure physical exhaustion that I said, you know what, I like, this is not working. Like, I can't take care of people if I don't take care of myself, right? You can't pour from an empty cup. So that was when I started to take care of myself, you know, eating better, exercising, like booking myself a massage on my calendar. My kids share my calendar with me. My husband shares my calendar with me. I put my massage time on my calendar. They're not allowed to schedule anything. They're not allowed to, plan anything. That is mommy time. And I got to a point where I no longer felt guilty taking care of myself, because the better I take care of myself, the better I can take care of them.
That's honestly so insightful. And it's really inspiring to hear that you managed to also carve time out for yourself in such a busy world. Another question that we have is that what are your tips for dealing with imposter syndrome, which I think a lot of us tend to go through at some point during our careers?
So I think a lot of imposter syndrome, especially for people who are minoritized, like if you're Muslim, if you're Black, if you're a woman, a lot of the imposter syndrome, I don't think it's just imposter syndrome. I think it's being othered. It's being told that you are not enough, right? That you're not good enough, that you're not going to make it, right? And I stopped looking at it as imposter syndrome when I, as a board certified surgeon, was told by another board certified surgeon, like, who are you to tell me how to manage a patient? Right? I trained in critical care as well. Like I did a fellowship in critical care, and I was reviewing the case of a patient who did not get the most optimal critical care that we could provide. And so I was criticizing it and saying, you know what, this patient needed resuscitation, they needed this, they needed that. And this person who has no training in critical care, who all his life, all he's done is surgery and had other people take care of the critical care. I do both, right? I operate on my patients and I do their critical care and I take care of them until they get out of the hospital. This person who his seniority is just in years and the number of years he's been operating, but as far as the clinical expertise is concerned, I'm more trained than he is, and he's here asking me, who are you to tell me, right? So, if I hadn't gone through all of this, I would have thought, oh my God, who am I? Who am I to be talking to the senior guy, who's Adan, by the way? But having gone through all these things where even when you prove yourself, you're not accepted, you're not acknowledged. The goalpost, like I went from being told that, doing a surgery residency as a Muslim, keeping my hijab was impossible. Having kids in a surgery residency was impossible. Doing the two together, forget about it. I was told from being told that this was impossible to a point where I was interviewing for a faculty position and a chairman threw my CV across the table and said, you've accomplished nothing in the past 5 years. Right? Yeah. So you can easily go from, what you're going for being called, impossible, to when you accomplish it, be minimized, right? And so I think the way to approach imposter syndrome is whose metric are you measuring yourself against, right? If you're measuring, if I am measuring my metric against my own self, like my own goals, and say, okay, this is what I want to accomplish. And not only have I accomplished it, I only wanted like a couple of kids in residency and have the rest afterwards. I overshot. Like I threw in a pair of twins. So based on my own personal standards, my own aspirations, not only have I achieved my goals, I've surpassed them, right? So based on my definition of success, I'm beyond successful, but based on somebody else's definition, I've accomplished nothing, right? I think that we don't make that distinction of whose measuring tape are we evaluating ourselves against, right? And I think that's where imposter syndrome creeps in. So I think it's important to know who you are and what you're shooting for. And if you've made it, because what they will do is they will move the goalpost. They say you can't do this. And as soon as you do this, they move the goalpost and say, oh, now you can't do that.
Okay. No, it's very honest, it's very interesting. I think it's also the idea of knowing whose race you're actually in and knowing yourself, isn't it, as well? I think another question that we've got as well for you is, one of the things that you mentioned earlier was that taking responsibility to creating the change that you want for yourself, because a system in itself isn't going to do it for you. But
Nope.
does that responsibility only lie with you, or is that shared with other people?
So in reality, it lies mostly with whoever wants to change the most.
Okay.
Right. In an ideal world, the system would, would facilitate this. Right. So one of the things that, are you guys familiar with the pipeline, the leaky pipeline? I think we call it here, where, it's the whole conversation about diversity, equity, and inclusion. Right. We need to increase diversity in all these different fields. How do they approach it? They approach it by recruiting more people into these fields, right? They recruit people into fields that were never designed for them, right? These fields are not designed for women, for anybody that's not white. It's not designed for us, right? We're just maneuvering through them and trying to make it a comfortable place for all of us. So these systems remain toxic, right? Like bias exists, racism exists. Here, you're not, in an interview, you're not allowed to ask anybody about religion. You're not supposed to ask anybody, women about their marital status or whether they're going to have kids or not. That's discrimination. Yet it happens all the time. It happens all the time. I have a tweet from a young lady who was told that if you take off your hijab, we'll give you an interview for a surgery residency spot.
That was something that was said to her.
Yeah.
Wow.
Yeah. My own program, they had a meeting amongst the education committee, all the faculty, and they discussed, should we ask Qaali to take off her hijab? Because that's not the image that we want for our program. Right? And lucky for them, there was somebody in the room that says, guys, you're violating her civil rights. Right? So they never asked. I found out when I was graduating that discussion was had. And the person who told me, they're like, we didn't know you back then, but knowing you now, you probably would have cussed us out. True. So the way they deal with, changing these fields is they recruit people into systems that remain toxic, right? They don't change the toxic environment. They don't, and anytime you bring it up, right, there's retaliation. The very people who bring up the problems with the system get retaliated against, right? Somebody reports sexual harassment or any kind of discrimination, they get retaliated against, not the person who perpetrated that, right? So there is a very little incentive for people to change systems that work for them. Does that make sense?
Complete sense.
There is zero incentive for people to change a system that they benefit from. So while idealistically the change should come from others, I think if you really want to change, you have to spearhead it. And you can recruit people, you can bring up the issues in different ways and get people on board, but change comes from those who really want it.
Gosh. And also I'm just thinking as well, is what if that one person that spoke up wasn't even in that space?
Yeah.
Gosh. Wow.
Yeah, nobody thinks so. It's always like one of the things that I always ask when I give talks on equity within healthcare fields, and most of the people that are sitting around the table talking about equity are the people who are not affected by any of the health inequity impact. Like they're not impacted directly by it, right? You have a bunch of Adam people sitting around talking about how to improve systems. Like, who's at that table? Whose voices are you not hearing? Whose experiences are you not hearing? Right? Who are you serving in that community? Right? If you're a healthcare organization and you don't know who your population is and what impact your systems have on them, then you're not fixing a problem. You guys are just talking, to write statements and just make yourselves look good. You're not impacting anybody. Who's at the table?
Like another tick box exercise, I guess. So another question that we have as well here is that in terms of when you were going through your training, did you have somebody like an accountability partner, someone like, for example, did you go through coaching or counseling? What actually helped you remain organized on achieving your goal?
I didn't know a thing like a coaching was a thing. What I had was family and support. So for home, I had my husband and my mom and my sisters. So, you know, anytime I felt, you know, the brunt of training and just discrimination and discouragement, especially from my you know, program director, I would talk to them and they would, you know, they would give me perspective. I think my mom was the person who told me, you know, every time this person, you know, discouraged me and made me really mad. And you know, he would tell me I was a chief resident and like almost done. And he would be like, yeah, you know, you're not going to be a productive surgeon. Yeah, you're going to graduate and whatnot, but you're not going to do anything. You're going to be at home with your kids. And like, he would get under my skin. And so I would go through cycles of, you know, doing well. And then he would, you know, say something like that. And I would push myself even more and, you know, operate more and do this and publish and go to conferences. And so I was talking to my mom one time and she said, Qaali, that guy has motivated you more than anybody else I know. so she's like, stop complaining about him. Go to him and say thank you. I'm like, you know, it's that perspective. Right. My mom was a big part of just always giving me perspective to look at things from a different angle. Same thing with my sisters. And then at work, one of the things that with the accountability that I had, like I had to stay on track. Just, you know, I didn't have time at home. You know, one of the things I ended up doing was I learned to manage my time much better. Right. So I would study at work. I would have like, you know, I had my PDFs and my question bank on my phone. So in between cases, any downtime, I would study. And then I had two of my colleagues that we always studied together. So after work, we'd stop by, you know, a bookstore or a coffee shop, sit there, study, ask each other questions. You know, we were more senior at this time and getting ready for our boards. So, you know, we held each other accountable for the studying. And they were like, Qaali, we were going to go home, but because of your schedule, you know, so like I managed my time better, they managed their time better. And so it was good for all of us. But, you know, if it's coaching that, you know, anything that can keep you on track, both from, you know, a psychological standpoint, because, you know, one of the things that I tend to steer away from is, you know, you're strong, you're tough, you can handle this. You know, sticks and stones may break my bones, but words will never hurt me. Words hurt. You know, people discouraging you, you know, you are working and, you know, working really hard and trying to accomplish something. And someone just, you know, just completely, you know, it minimizes what you're doing. It hurts. So, you know, what are you doing with that? Who are you talking to? And I think that's a very important thing to take into account is, you know, express all those emotions, get it all out, talk it all out, cry it all out. I've done that. You know, I just dump it on my mom, dump it on my husband or sisters, and, you know, talk it out, and you go back to work. You know, it's all out, and you're there to do your work and take care of patients.
MashaAllah, if I can interject, I am really loving this conversation and I'm so very inspired by your talk, as well as Sumayya's questions, which have been really interesting. And I just wanted to really go back to the previous question about systems, really, and recognize that these systems, as you said, are designed for certain people. And by that, they're also designed to exclude others. So, and I think it's really important in saying what they are. Nowadays, I talk about the patriarchy. I talk about the fact that it's a racist, supremacist, imperialist, capitalist system, right? Yep. And when you recognize that, it's all of that. You then also recognize the sort of the anti-Black sentiments, you recognize the anti-women sentiments, and it then also highlights what you've got on that board there, taking up space, right? And I love that. You know, you actually say, if you're not invited to the table, you bring a folding chair, you sit down and say, okay, I'm going to take the space, right? And I think for me, it highlights how much of a just sort of a catalyst for change you are, right? And that you create your opportunities when they're not given to you. So I wanted to ask, where does that come from? It's clearly something, you know, it's resilience, isn't it? Where you say, do you know what? Yes, the system did not have me in mind when it was created, but I am here and I'm going to be the catalyst for change in order to make this happen. So where does that come from?
So it comes from a very unlikely source. It comes from a 13-year-old bride who was married to a 40-year-old, ended up having 10 children and raising them to be scholars. And she was never educated. She never had any formal training. This is my grandmother. Okay, her name is Fatima Ibrahim Umar. Right. So she, at a very young age, you know, was thrust into this marriage. And I remember talking to her. I was very close with her. I lived with her in Somalia. And then when we came here, even though I was with my parents, I spent majority of my time with her. And so it was my junior year in high school when I was, you know, struggling with the hijab, right? I had lectures from people who didn't practice the hijab, forcing me to practice the hijab at a very young age. And so for me, it was this convoluted conversation of, okay, you know, do as I say, not as I do. And so, you know, the religious aspect of it, you know, wasn't relayed to me at an early age. So, but deep down inside, you know, I'm very spiritual, and I've always identified with, like, even when I didn't wear the hijab, I've dressed very, you know, very modestly. And so I was struggling. I was like, I really want to wear the hijab, but I also want to pursue this. And from what I've been told, I had Muslim women who are, you know, physicians tell me absolutely not. You know, if you want to be in medicine, the hijab is just going to get in your way. You know, you're just going to be wasting your time. Don't even think about it. And so I was getting all these mixed messages, and I started thinking about my future and what I wanted it to look like. And I saw myself wearing a white coat and a black hijab. Like, I actually took a picture like that. Because that's how I saw myself. Like, I wanted to be a surgeon. I wanted to be a physician. I wasn't honed in on surgery at the time. But I really, like, deep down inside, I identified with the hijab and I really wanted to wear it. And so as I'm struggling with this, I meet a woman who's a physician, and she just completely crushes me and says, no, you can't be a surgeon. And so I'm talking to my grandmother about this, and then she tells me the story of, you know, how she raised her kids. And, you know, at a time in Somalia where, you know, it was the tradition to, as soon as they finished high school, marriage, have kids, that was it. She changed that for her daughters. She had 6 girls and 4 boys. And she, you know, not knowing any, you know, not being formally schooled, she knew the Quran. And one thing she held very dear was Iqra. She said, the first words spoken to Prophet Muhammad sallallahu alaihi wasallam is Iqra, right? So education is going to be a primary, you know, goal for all of you, boys, girls, doesn't matter. So she made it a priority. And so the way, and her daughters, she said, you know what, I want you guys to be independent. I mean, she struggled with, you know, being single for a while and then getting married again, having more kids, trying to provide for them. And so she's like, I don't want my daughters to go through this. You're going to be independent. You can get married, have kids, but I want you to have independence. I want you to be self-sufficient. Right. And so her idea was that if they're educated, they can do anything. And so she allowed them to, you know, travel abroad, get scholarships. And what she would do with families, like, you know, she got all the backlash and, you know, Father Ibrahim, you know, they're inappropriate, they're going to school, they're not getting married. She would have people, you know, suitors coming in, cousins making, you know, matchmaking and these things. But the way she approached it, she didn't argue with them. She didn't, you know, get into fights with them. She just smiled and nodded. But behind the scenes, she told her daughters, you're going to get educated. If you have to go to London, if you have to go, one of my aunts went to Thailand, my mom went to Italy to get her training. She said, you do whatever you need to do. I raised you well. I trust you, right? I raised you well and I trust you to behave like a Muslim woman. So go get your education, then you can settle down and have kids. And she made that happen for all of them, right? And people, what she would do is she would welcome them into her home. They would be there, you know, asking for her hand in marriage. And she would say, it's up to her. I'm not going to force her. But behind the scenes, she talked to them. She laid down the groundwork for them to make their own decisions and pursue what it is that they wanted. And so the question she asked me after all of that, after she telling me the story, is like, why are you arguing with people? Why are you asking people for permission for you to wear your hijab? Is it up to them? No. Do you want to wear the hijab? Do you believe in it? Yeah, wear the hijab. You want to have kids? Have kids. Why are you asking permission? You don't need permission from anybody to do what it is that you want to do, unless they're directly standing in your way, and you know you have to you know, take steps to get them out of your way. But what people think doesn't matter. Do what it is that you want to do, right? And at the end, you know, when the war happened in Somalia, we were lucky because we had family abroad who, you know, were professors, and we had visas. She was so far ahead of her time that she allowed for our family to leave in a timely manner and have all these other opportunities that you know, if she hadn't forced it on her kids, you know, we wouldn't. So that's where I don't know if I call it resilience, but just having that, you know, that lesson ingrained in me from a very early age to say, I don't need to ask for permission from anybody. Like, if I want things done, I'm going to find a way to get it done.
MashaAllah. And thank God for AA Fatima. I mean,
thank God for AA. We used to call her Hindafai. Yeah.
Yeah, and I can definitely recognize that source of strength and, you know, the sort of women that she's created, isn't it? And that strength that she's instilled in you. Yep. So moving on from strength, I want to talk about joy. I want to find out about the joy that you have in surgery. What was it that you saw in surgery, and what joy do you derive from your work?
So the joy that I have in surgery. So when I've always liked working with my hands, and I like, you know, problem solving and being, you know, very analytical. And so, and I've always been interested in medicine and fascinated with, you know, how the body works and things like that. So when I went into medicine, I initially, like, I wanted to do CT surgery or vascular surgery. But then I was told, you know, oh, it's impossible. You can't have a family, blah, blah, blah. And then my third year, I was doing a surgery rotation, and the chief resident was a really great guy who had a family of his own. He had like 4 kids, and his wife used to bring the kids at home, the kids to work for him to play with. And he was the one that told me, he's like, Qaali, surgery, he's like, residency is a finite amount of time. It's going to end, right? So it doesn't matter whether you do 3 years or 5 years, it's going to end. It's what matters is, you know, what you do for the rest of your life. And so, but before that, how I got, you know, sucked in was, we were doing a femoral artery dissection. We were doing vascular surgery and doing a bypass. And he saw like how excited I was about, I would come in early, I would leave late, I would ask a lot of questions. And so he's like, okay, you really, really like surgery? Yeah, I'm gonna let you do this. And so he showed me how to dissect out the femoral artery on one side. And he like handed me a right angle clamp, and he's like, here, you do this. And as a 3rd year medical student, I was, you know, somebody's big femoral artery, like, you know, opening it up and going around it and putting a vessel loop around it. And I am in heaven. Like, I've been up since like 5 o'clock in the morning. This is happening at 6 p.m. I'm exhausted, but I'm, you know, just, oh, so excited. And I was like, oh my, I have to do surgery. I have to do surgery. And then I was doing other cases. Like, I did a toe amputation one time. Like, it was like dead toes, and, you know, it was gangrene, and I cut it out, and I called my mom. I was like, Mom, I cut somebody's toes. And she goes, oh my God, why? She's like, what did you do? Why? On purpose? I'm like, yes, on purpose. But, you know, those little things, you know, from a toe amputation to you know, doing a femoral artery dissection, it's just, it's a feeling that it's really hard to describe. It's like you're on another level. And nothing else in medicine made me feel that way. And to this day, I mean, I do trauma. You know, I have like recently operated on a young woman who was shot in the chest and having chest compressions for 15 minutes before arriving, and her heart was completely stopped. Right? Do a thoracotomy, open up, cross clamp the aorta, give her blood, restart her heart. You do open cardiac massage, and she's back. Right? So there's very few things, very few things in medicine that gives you that instant of gratification. So yeah, that's my joy in medicine, in surgery.
Amazing. SubhanAllah, and all the more power to you. I don't think I could ever do surgery, but it's a good thing we have you. And just moving from that, I wanted to ask you a bit about just going back to what makes you so exceptional, really, in terms of your Somali Nimo and your Deen, and how that interplays in terms of who you've become. Can you tell us, so you mentioned a little bit about having been in Somalia at some point, but what does Somali Nimo mean to you, and what does your Deen mean to you, and how do these things combine in order to help you further sort of celebrate and do the work that you do?
Yeah, so Deen, I think, is like primary in my life, because I feel like there are so many things that are outside of our control that, you know, what I find relief and satisfaction in is knowing that when things are outside of my control, that it's, it's Allah's plan, right? There's only, very few things that we have control over, and beyond that, and that's one of the things that has actually kept me going on my journey is tawakkaltu ala Allah, right? And I started feeling, relying on that a lot from a very early age. When I was in college, I was doing research with this professor, and about 2.5 years into it, I was deciding between going, doing research and PhD route versus medicine, and I really was drawn to medicine. And so I told him, I will no longer be working in his lab, and I was going to start, getting ready for my MCATs and getting ready to go to medical school. And he had written me a letter of recommendation. And when I told him I wasn't going to be working in his lab that year, he took back his letter of recommendation, and he said he was going to call all the schools that I was applying to and tell them how terrible I was, and basically kill my career as a doctor. And, being, I think I was like a junior in college at the time, or it was my second year. I did 3 years of college. It scared me. It crushed me, all these things that I've been working for. And now, like, it takes one person to make a phone call, and it's all going to come to an end. And, I was bawling over it. And finally, I just snapped out of it. And I said, you know what? He's a human being, right? If I'm meant to become a doctor, if I'm meant to become a surgeon, it's up to Allah. I can make it, right? He can do whatever he wants. If it's written for me, nothing is going to change. And I went, washed my face, prayed, moved on. And alhamdulillah, I applied to 2 schools. I got into one of them, and the rest is history. So from that, moment, every hardship that I faced, and, when I've been at my wit's end and I felt like, okay, I no longer have control, I rely on Allah. So my faith has gotten me through everything and brought me where I am today. My Somali Nimo, like I'm I think I'm too big of a Somali. Like, I love Somali music. I love Somali food. I love our culture. And to me, every time I've, being assimilating into these areas, I feel like you have to disavow who you are. And if I'm not Somali, if I'm not practicing my deen, I'm not whole, right? I don't feel like myself. But when I remember starting to feel more confident the moment I started wearing my hijab in high school, right? When I didn't wear my hijab, I was shy. I didn't talk to anybody, you know, because I didn't feel comfortable. But as soon as I started wearing my hijab, I started coming out of my shell because it was a true representation of who I was. And when I talk about being a Somali, like, I mean, I make some boosts during Ramadan and take it to work, and everybody, you know, loves it. I love sharing who I am. And so I think it's what I talk about, you know, in the masterclass, is like, we have to know what our values are and who we are as people. And when we are, you know, the best representation of ourselves, that's when, you know, we can be who we are and have a presence and confidence. Because when we're playing roles, when we're fitting in, I think, you know, parts of us are missing, and what parts of us are missing, I don't think we're comfortable.
Absolutely. So I think, Sumaya, if you want to come back into the conversation, I'd love to have you come back and join us and ask some more questions.
Honestly, Dr. Qaali, in terms of your steadfastness in your deen and your acknowledgement of your own limitations and your passion, it's just beautiful to listen to. I just want to ask a couple more questions from the audience. First thing, a lot of people have echoed how amazing your grandmother is,
Yes.
and ahead of her times, mashallah. So one of the questions is from an audience member who said, how best to deal with self-doubt, particularly when you take a break from clinical medicine for a number of years?
I think that's a tough one. You know, we all have self-doubt. Like, some of the best surgeons I know, some of the most experienced surgeons I know have self-doubt. Okay. And I think, you know, it's not a bad thing to have doubt, right? I think the bad thing about doubt is letting it stop you, right? Every time, like, when we talk about complications all the time, the first thing every surgeon asks is it my anastomosis? Is it my surgery? Are they having a complication because of me, right? So I think it's always important to be critical of yourself, but I think it's also important to continue to want to learn so that you can get over that doubt, right? I think if you don't have doubt, if you think you are the best thing, you know, next to sliced bread, that's a problem, right? But having self-doubt, I think, is one of those things. It's like fear, right? It motivates you to get better. So I would say, don't let doubt stop you. I think that's one of the things that I see more often is people have, you know, doubt their abilities and their expertise, and they don't even try, right? They just stop, and they're like, oh, it's too much. I can't, I won't be able to do it. How do you know? How do you know if you never try?
It's true. Because in one way you can use it to fuel you, and another way you can use it to hinder you, isn't it?
It's all in how you look at it.
It's true. And another question that we've got from the audience is mainly about your partner, actually. So how important do you think it is to marry somebody within the same field, so within the medical field? Is it important so they can empathize with you better, or is it the opposite?
Well, I can't speak for people who've married people who are in medicine. Yeah. My husband is not in medicine. He's an accountant. Alhamdulillah. I don't know with like two people with that kind of schedule. I mean, I know people who make it work. I know a lot of people who are both physicians who make it work. But I think more important than the fields you guys are in is knowing where you guys are, right? You know, as long as you guys respect each other's you know, goals and ambitions, and you're there to support each other, then it really doesn't matter, right? So this is one of the things that I usually talk, you know, the whole concept of matrimony, marriage, especially within our Somali community. I like to bring it up because I think it's not talked about enough, but it's a very important conversation we all need to have. Yeah. You know, I have a lot of young women reach out to me saying, you know, they want to get married, but their partners have this expectation that their ambitions are limited. And once kids come in, you know, things will change. I've had my own experiences with that, where I had a suitor tell me, it was like before I even got into medicine, I was a pre-med and I was thinking about what I wanted to be. And he said, Ali, doctor or not, surgeon or not, you still walk 10 feet behind me and only what I say goes. And I said, okay. And he learned how many different languages I could curse in. And then like a week later, it's like this conversation never happened, and I was just supposed to keep going, like, you know, this is normal.
10 steps behind, of course.
Huh?
10 steps behind, of course.
Yeah. And it's, you know, and I have a lot of young women that reach out to me now saying the same thing, that, you know, that they're planning on getting married, but there's this expectation that just because you happen to be, you know, a woman who works and, you know, makes money and does this, that there are different stipulations for your role at home. And I always feel like, you know, we're trying to push back against these social norms that we've all been ingrained with, but at the same time, we're using them to change the dynamics and impact the dynamics in our relationships. And I think that's dangerous. You know, the way I approach it is we're partners, right? We're equal. And it's us against the world, right? It's not you and I are competing and, you know, one-upping each other. It's we are building each other. I build you, you build me, right? And I wish we had that conversation of how to make that happen, how to unite as a team against this world that has, you know, gender stereotypes and gender roles, and, you know, always like I work so, and it's not just within our culture. I think it's society as a whole. I worked with this Adan surgeon, and her and I were on call together. And I think she had like 2 kids when she was a 4th year and a 5th year, and you know, she's all about feminist and, you know, this and that, and we're badasses and women working, and you know, I agree with women's empowerment to a certain point, but when feminists go overboard, it drives me nuts. But she's sitting there, I'm like FaceTiming with my kids, and out of nowhere, she's like, yeah, you know, that's what the men do. They stay at home while the women work. And I'm like, you know, don't let these extreme ideas of what a family should be and whose role is what, you know, infect your relationships. I think that's a whole different conversation that needs to be had. But yeah, that's how I feel about that.
Thank you.
I know you guys didn't ask for all of that, but that's what I had to say.
No, thank you so much. I think we've even slightly overrun, but Dr. Qaali Hussein, firstly, thank you so much. It was honestly a highlight of a conversation for me. We have laughed. It was serious points, emotional points, but it was just the most informative talk, honestly. And thank you from everyone for this fantastic talk. So in terms of how people can keep in contact with you, do you have, like, in terms of your social media, your website, is there anything that you can provide?
Yes, I am on Twitter at Qaali Hussein 1, and I think Facebook and Instagram, Dr. Qaali Hussein. You can also go to my website, qaalihussein.com. There's a contact me page there that for any services, speaking engagements or whatever. And I do have a masterclass that I'm putting together for putting up registration forms for in the next few months. So if you want to join, it's mostly for leadership development. I think, you know, we talk a lot about, you know, barriers to entry, but one of the things that I do love teaching is when you get in, how do you navigate, how do you secure your spot, and then how do you lead, right? I don't just want a table, you know, a chair, a folding chair at that table. I want to be at the head of that table. I want y'all to be at the head of that table, and I want you guys to lead, right? And I think that's where that's where I headed in doing this work. Is I don't just want to improve, you know, diversity. I want us to be leaders in these fields and, you know, make the changes that we all want. And so, yeah, you guys can, I'll put it up when registration is ready for that. Feel free to message me on any of those platforms. Happy to connect with you guys.
Honestly, thank you, and thank you so much. And I think in the chat as well, a lot of the audience members are saying how inspiring your talk has been. They're all thanking you so much. Du'as are also coming through. Fantastic. And I myself messaged Dr. Hussein when I was a medical student a few years ago, and she replied and gave me a fantastic advice as well. And your masterclass sounds absolutely fantastic. So please all do sign up. But yes, Dr. Zakaria Ali, do you want to say anything?
Nothing but my gratitude as well. I think I myself am completely inspired, and I can only imagine how you inspire other people in your environment in person. So that is our loss, the fact that it was not in person, but hopefully, inshallah, one day post-COVID, I'd love to invite you to the UK and have you with us in person. But also, yeah, just thank you again for this talk, but actually also living through your inspiring story. I feel so motivated by it. Thank you.
Likewise. Thank you so much, Dr. Hussein.
Thank you for having me, guys. Thank you so much.
Take care, everybody.
Bye.